I'm Dr. Payam Moazzaz with New Era Spine, and today we'll be talking about the benefits of robotic spinal surgery. One of the nice things about robotic spinal surgery is a lot of the surgery is actually done before the patient ever gets into the operating room. So I sit here at my desk, and using this robotic software, I can plan out the perfect surgery for this patient based on their anatomy. The way that works is we obtain these images through a preoperative scan, and then the software allows me to go back and forth, drawing out the best angles and sizes for the implants for that patient. You can see we have the ability to change the angle as fine as 1/10 of a degree. We can also change the diameter and length of the screws so that I know the perfect type of instrumentation for this patient before we ever get to the operating room. Another advantage is our incisions are much smaller. So before robotic surgery, we would have to remove these muscles off of the spine in order to get to the engine, if you will. We had to open up the hood. And that causes a lot of destruction and trauma to these muscles. The less we can manipulate the tissues, the faster the patient will recover from the surgery and leave the hospital. With the robotic surgery, now through much less invasive approaches, we can do a surgery like this and basically place instrumentation into the lumbar spine as you see in this model. And that's what we're seeing with the robotic planning here. So I've already gone ahead and planned out this patient's surgery. And I know exactly what it's going to look like when we're done. So when we get x-rays after the surgery, this is exactly what it'll look like with the real implants. And we're looking at the spine in this view and on the side view, and you can see the titanium screws that we've designed for this patient here. Another advantage of this type of surgery is less bleeding. So because the incisions are smaller, we're not dissecting all the muscle off the spine. The patient doesn't bleed as much, they have less pain, less risk for infection, and they leave the hospital faster. We've actually looked at our data since we started doing robotic surgery in 2012, and on average, patients that are going the same type of surgery before the robot versus with the robot. With the robot, they're leaving the hospital 1.1 days earlier than before the robot. And that's a big difference in someone that's having a 2 or 3 day hospital stay. Another advantage is there's a lot less radiation exposure with robotic surgery. Traditionally, when we're talking about surgeries like this, the surgeon relies very heavily on x-rays to make sure the screws are going in the right position underneath all of the muscle. The beauty of the robot is we only have to take 2 images at the start of the surgery to sort of register or sync the robot to the patient's preoperative planning. Once those images are obtained, we're done taking x-rays, and we can place all of these screws with incredible accuracy using the robot with no need for further radiation exposure to the patient, to the surgeon, and the entire team in the operating room.